Good morning, everyone, and welcome to Britam COVID-19 and the Third Wave webinar that we'll be carrying out today in liaison with Dr. Jeremy Gitau. I would like to welcome all our participants and attendees into the meeting. And considering of the time, I'd want to begin the meeting immediately. So thank you for joining us, all of you. And today, as I mentioned earlier, the webinar will be facilitated by Dr. Jeremy Gitau, who currently chairs the COVID-19 Champions Response Team at Kenya University Training and Teaching and Referral Research Hospital. He also heads the Accident and Emergency Department at the same hospital, and he's also the founder and the CEO of Tarim Safiri, which he'll tell us more about as we proceed. So without any further ado, I think I'll hand it over to Daktari to proceed. And just to introduce one more person, we have Nelly Chepkemoi, who will be our sign language interpreter for today. So if we have any attendees who would be having a hearing impairment, then Nelly Chepkemoi will be able to take you through the webinar, of course, as Dr. Jeremy takes us through. Daktari?
Yeah, thank you. Thank you, Jessica, and also the Britam family for having me today. So as you mentioned, we'll be going through the COVID-19 awareness and also looking at the updates around the vaccines, which is what currently is the main topic around vaccines. So yeah, so that's basically what we'll be looking at. And thank you for introducing me. Dr. Jeremy Gitau, I'll be talking more about that. So by the end of today, this is what will be our learning outcomes. So we'll be looking at what is COVID-19. We'll be looking at what are these updates we are talking about and where are we currently as a country and what exactly is happening around even globally. We look at what is a vaccine, how they are made. Is COVID-19 vaccine safe? I know there are several questions around that. We look at the different types of vaccines, how the vaccine is given. We'll also look at what are the side effects. And then finally, I'll do a brief introduction to Dr. Safiri, and then we'll go through our question and answer session. So at the end of it all, that's what we'll cover. If there are any questions, I think most of them will answer towards the end. So feel free to ask as many questions and any clarification that you may be having. So just as a brief, as we mentioned, that's the hospital that I work daily, and we look at that later. So looking at the topic of the day, which is COVID-19, we'll be looking basically at a brief for people maybe who remember some biology, just a bit biology, and you see why that is important in a short while. So coronavirus disease 2019, as it's so called, it's actually COVID-19, which is an abbreviation. And basically, when you're looking at the disease, this was the naming that was done. That was in around March of last year, where it was called COVID-19. The virus that causes it is called the severe acute respiratory syndrome related coronavirus 2, or the SARS-CoV-2. For people who've done the COVID test, I'm sure you've seen this name, SARS-CoV-2. Initially is reported as either reactive or non-reactive, or positive or negative, depending on the status of the patient. So if you think about it, you think about HIV and AIDS, which people know about. HIV is a virus and AIDS is the disease. So it's the same thing as coronavirus disease and the virus causing it. One thing about this virus, as much as it is initially it was called the novel coronavirus or the new coronavirus. Coronaviruses have been there for a long time. Actually, we think about 30% of the causes of common cold are mainly due to these coronaviruses. They are mainly what are called zoonotic viruses. That's a virus that is usually spread from an animal to a human being. And it's not the first time we're encountering these outbreaks from these viruses. In the past, we've had what are called the SARS and the MERS outbreaks, or what was initially called the bird flu. If people remember a few years ago, around 2013, we had these outbreaks and these pandemics that had been caused by by bird flu and others. So it's not a very new family of viruses, so they've been there with us. As I said, the characteristic is that they're zoonotic, meaning they are spread from the animals to human beings. That's how most of them will actually start from. And we remember last year, that was 2019, towards the end of the year, from November and December, that's when we started experiencing this and news started spreading about the new virus that had been identified, and people have started to actually die from this. It started in China, in the wet markets, and it was suspected it's because of eating the pangolin or also the bat soup. So the reason why they are called coronaviruses is mainly the shape. It's shaped as a crown, and when you look under an electron microscope. Globally, so far we've seen more than 130 million people actually infected. The deaths currently stand at about close to 2.9 million people have died. But however, majority have actually recovered. 74.5 million people have recovered. And we'll be looking at who is more vulnerable, who is more at risk to die from the disease. In Kenya, this was a day ago. That was on the 13th. Total cases stood at 146,000. This is the current statistics that we've seen all over the country, and the positivity, which is what is used actually to map out what are so-called the waves, stood at 16.3. So this has been going up and down. In the last, I would say, last 2 weeks, it has remained less than 20%. As you may remember, when the curfew was actually starting, we were at 26%. So we can say there is an impact of the restrictions that have been put in. We are starting to see a decline, especially in the counties where there is these restrictions. Our fear is that hopefully not, when the borders are opened and the new counties are allowed, that we not see an upsurge of cases as well in those counties where the positivity was a bit low. Majority have actually recovered, and actually as we start, most people have actually survived the disease. The case fatality rate is about 1.6%, which stands at about 2,394 people have actually died from COVID-19. And if you look at this, is the typical wave that we're talking about, the third wave. Our fear is that whether we'll keep getting these waves, it's something we have to keep watching, and we have to continue putting measures that we do not get these upsurges in the cases. And we'll see some of the ways of preventing this actually from happening. One reason why we think now there's the third wave is the new variants of COVID-19. That's both the UK one and the South African one. These were actually identified in our Cambridge labs, and it was reported that we suspect, other than other measures not being followed, the social distancing, all the political rallies that were happening, there was also, in addition to that, the new variant, which we think is also responsible for this third wave that has actually happened in the country. The mode of transmission hasn't changed. It remains mostly the same. Mostly it's through contact transmission, either through a handshake or the high touch surfaces. So, and for people who are in offices, or mostly in offices, we are saying people who are in the tea room, especially, or where you sit as a team to discuss. That's where most people actually get the virus from. And the main reason being they will be touching the microwave. If you have a fridge, you're using the same fridge. So most of these become a high touch surface, and that's why we encourage that they get cleaned. The doorknobs as well, especially going to the washroom and main offices. So we need to keep cleaning these surfaces to make sure that people do not get the virus from the contact. One thing we must remember, the virus can survive up to 4 hours on these surfaces. So it's good you keep cleaning them and making sure that people are not getting the virus from there. In terms of the other mode, is the droplet. This remains actually the main one. And this is mostly either a person who is coughing, sneezing, or even some people when they are talking, they're able to actually spread the virus in this way. We also have the airborne transmission. This is not as common as the others. And the main reason is the particles that are actually come out of, which have the virus actually quite large, and they're not able to spread very far. However, if in a room that has windows closed, not good aeration, and there are people without masks, in case they cough or sneeze, then the virus has been shown to actually stay for up to even 6 hours. So it's important that if you're in a room that is enclosed, make sure the windows are open and people are keeping social distance. When you look at the incubation period, it's actually up to 14 days. And what happens is during this period, if you did a test, especially for those, if you do a test very early after exposure, it means the virus may not be detected in the body yet. It's there, and it's actually what is called incubating. So it's important if in case you come into contact with someone who is confirmed to have COVID-19, you give it time, give it up to a period of a minimum of 7 days, not unless you have symptoms. If there are no symptoms, you can do the test at the 7th day. And at this time, you're able to know whether the person is positive or not. The presentation has remained almost the same. However, we've now started seeing some unique symptoms presenting. In fact, right now, any patient who is presenting to a hospital facility, one of the recommendations is that they get a COVID test. And this is because we are at what is called the community level, where not only the travelers or people coming in from other countries or other regions are coming with the virus. The virus is at the community. Right now, I'm sure everyone knows someone who's actually gotten the disease. Some have died, some are fully recovered. So it's no longer where people used to say, I don't know anyone. Right now, we all know someone. It's highly unlikely we don't know someone who has COVID-19. So most of the people will still present with a cough, fever, and difficulty in breathing for those who have symptoms. Others have also reported headaches, runny nose, loss of smell and taste. So this still become common. The uncommon symptoms that we are currently seeing is new things like nausea, vomiting, diarrhea. We've had a patient just come in with a headache and there was no other symptoms. Other than the headache, actually, we had to evaluate, and one of the things we found is that actually they are COVID positive. So it's important if you develop any of these symptoms, go have checked, make sure the medical person is also looking for other causes of disease other than COVID, but more so also to make sure that the COVID is negative. The way most people will present is either they will have no symptoms or mild, or some will present with moderate, or others will present with severe. For those who are asymptomatic and mild, actually comprise the largest group of people. More than 90% will actually be in this category of asymptomatic or mild symptoms. Asymptomatic, we're just saying the person doesn't have anything. And this has been a major concern, and for most people actually who've spread the virus, they've been in this category because they didn't have any symptoms. The children, the younger people, and that's why we were discouraging people from, if you're in a town and there are many people with the virus, make sure that you're minimizing contact with other people, because most people will be actually asymptomatic. The mild, those I talked about, someone may either have a headache, they may have a runny nose or nasal congestion, they may have a dry cough, difficulty in breathing, but not requiring oxygen. They may have chest pain. So many symptoms, loss of smell, but all these things that can actually be managed from the house. For people who have moderate disease, now people, if you had diarrhea and vomiting, you're not able to actually retain any meals, and actually you need either IV fluids to be in the hospital. If your oxygen levels, if you look at them, they actually at this time less than 90, and you're actually requiring to be supplemented. However, with even a few liters per minute of less than, actually most people will be between 10 to 5, they're actually able to saturate, their oxygen levels are able to go above 90. So most of these people will require admission, but in a general ward. These are also people who can also be managed from home. However, under the guidance of a qualified physician, and also nurses have to be there to closely monitor to make sure that the person is not getting a severe form of the disease. They must also have a plan of how they'll go to the hospital and which hospital. For people with severe disease, they actually get what is called organ dysfunction. So, and the main organ affected is the lungs. So these are people who will start developing difficulty in breathing. We give them oxygen is not adequate to get to the normal levels above 90%. So usually we put them on other what is called mechanical ventilation, or using like non-invasive ventilation. Or for people who may have had, we put people on a big mask that covers mostly their nose and mouth, and this is able to deliver oxygen at a higher pressure. In that way, the oxygen levels are able to go up. The other thing is that in case they have kidneys affected, kidney failure, then they require dialysis, mostly in the short term. In addition to that, we manage other conditions like if they are diabetic, controlling their sugars. If they're hypertensive, we're also trying to reduce that. So we're basically looking at the person as a whole and managing other conditions they may be having, underlying conditions. One important thing that we must remember, there are several factors that determine how a person will present. The first one is age. For people who are younger and with no underlying conditions, most of them will be in this category of either mild or asymptomatic. For people who have underlying conditions and the elderly actually anyone above 50 becomes a high risk. One is that they start developing underlying conditions like diabetes, hypertension, people with cancer, people with chronic kidney disease, that is people who are undergoing dialysis, people with chronic lung diseases like asthma, what is called as COPD, people with HIV and AIDS. So this group of people actually become people at a higher risk of developing severe disease. And that's why we say anytime they test positive, these are people who need to be followed up very closely. Even though they may be asymptomatic and you have underlying conditions, you need a healthcare provider to follow you for the period that you're going to be isolating until you recover fully, or until there are no symptoms. So it's very important that we get observed. And if you have any underlying conditions, have a doctor following you up and making sure that you're not getting into the severe form of the disease. And this is one of the reasons why the people above 58 years with underlying conditions have actually been selected to actually receive the vaccine. We've seen many people actually die because of these underlying conditions. So prevention still remains the main thing in the management of COVID-19 as one of the ways to make sure that fewer people are actually getting affected by the disease. Hand washing is still very key, either with soap and water or alcohol swab. And for the alcohol swab, they said it has to be at least 60% alcohol. This is very key because that's what has been shown to be effective. And the only time we recommend, if there's no alcohol swab, then use soap and water. If you have both, actually we recommend for one to use the soap and water if their hands are actually soiled or if there's visible dirt. So that's what we recommend. But in any other time, both of them work as if they are both effective. The other way is wearing of masks. Because this has been mentioned severally, and people continue to wear masks, especially if in a public setting. Make sure you're wearing the mask, and it can either be the N95, the surgical mask, or the normal cloth mask. All of them have different rates of protection. However, the most important thing is that they reduce the risk of transmission to the next person. So it's important that you still wear the mask. It will still protect you. Avoid touching it because the reason why you're wearing it is to prevent the virus from coming into contact. So if you keep touching the mask, there's a risk that you can actually transmit it to yourself or to another person. Using the proper coughing etiquette, coughing in your inner elbow is the other way, and also keeping the social distance. Avoid being in public with especially in crowded places, because that's where most people are getting this. Attending funerals, weddings, those are the most places where most people are getting the virus from. Testing, PCR remains the the gold standard, that's the polymerase chain reaction. And the way we collect the samples is either using a throat sample or a sample from the nose. So those two methods are the ones we're currently using. We also collect for someone who's had a tube inserted in their throat, then we get a sample from there as well. We also do what is called a rapid antigen test. And the rapid antigen test, as the name mentions, it's a test that actually takes a very short while, about 20 minutes, within which you're able to get a result. And this is used more as a screening tool. You want to find out in a particular group how many people actually have the virus. And if a person is symptomatic and they test negative, then you need to still go ahead and do a PCR. However, a negative test with no symptoms, then it's unlikely the person has the virus. The COVID antibody test usually is done for population studies. You want to find out in a certain community how many people have actually suffered a particular disease, in this case, COVID-19. So they are more for studies you can do to check if in the last 3 months you've gotten the virus. However, you can't use it most of the time to be sure that currently you have active disease. So in case you test positive, then the question becomes, what next? I think now we are aware, we no longer send this team to your house, and this is something that has actually changed, and it's no longer happening. So the government will not send these people in. If they need to come and assist you, they will come and either address in your house or in your compound, but still maintaining your confidentiality to make sure that also we are reducing the stigma around COVID-19. As I said, majority of the people, actually more than 90%, will actually have either be asymptomatic or have mild symptoms. And most of these people will actually be managed from the house. One thing which is very key, I know right now if you ask anyone who was tested positive what medication they should take, most people will give you actually the whole prescription. They'll forward you either a message they got from a doctor friend or what the other person took. So the first thing is that we must be very careful. In fact, most of the people who ended up in ICUs are people who will tell you, I started this treatment or this other protocol that was shown to work, and I did not go to hospital. So most people are actually self-medicating, and this is becoming a big risk for majority of the Kenyans. So it's very important anytime you do the test or anytime you have the symptoms, get tested, see a clinician, even if it's the first time. Let them make sure that you don't have any underlying condition, then they can go ahead and allow you home for the home-based care program. The people who qualify for home-based care, one, as I said, they have to be stable enough. That is, either they are symptomatic or have mild disease. The second one is they must have an appropriate caregiver at home. By appropriate, we mean there's no one who is at home with underlying conditions, or they're elderly or pregnant, or who has immunosuppression. That is, either they have other conditions that could put them at risk of severe disease. You must have a separate bedroom or isolation space where you can easily isolate without interacting with the rest of the family. I know for most people this is not possible. However, this is a recommendation, and basically you're trying to protect the rest of the family members from contracting the virus. The other thing we recommend is to have resources, adequate resources, both food and amenities. Then the other important thing, and which now we're emphasizing on, is that you must have either both a thermometer and a pulse oximeter. And a pulse oximeter is very crucial because we are seeing most patients coming to us. The oxygen levels have been low for quite some time, but they don't know. And the only way to detect your oxygen levels are low is to use a pulse oximeter. We currently have a condition called happy hypoxia. This is where you look normal, you're doing your things okay, but your oxygen levels are quite low. And most of these people sometimes end up with sudden death, as we've seen in some of the cases, either due to a cardiac arrest from either the heart being affected or a clot that has actually developed without you knowing. So it's very important that you have these gadgets with you anytime you test positive. So if you meet the criteria, then you proceed and have a home-based care program. Usually the government recommends up to 10 days for those who do not have any symptoms. And after 10 days, actually, you're discharged from the program. For people who have symptoms, they indicate you have to have stayed the 10 days plus an additional 3 days without symptoms. So almost a total of 14 days. For most people, that's why most companies will also adopt the 14 days rule. After 14 days of being asymptomatic, then actually you should be able to go back to work. Most people will do a COVID test, and the main reason why they're doing this is to mainly more for their psychological comfort. You don't need to do a repeat test if you've been asymptomatic for more than for the 10 days as I mentioned. The other thing that happens for those who test positive, there's no cure. There's no medication that you'll be given and told this is the cure for COVID-19. That is a lie. And it's important for us to know that. I know there are several regimes which I've seen people using various medication. The current studies that have been done have shown actually very few drugs to be effective, and most of those drugs are given to people actually in the hospital. These are people who are requiring oxygen or people who've actually been intubated. For majority of the people who are symptomatic or with mild disease, what we do is supportive care. We'll just manage the symptoms. So if a person has fever, which is very common, or any pain, then we give paracetamol. The vitamin C and zinc that people take, these are mainly to try and boost the immunity. However, immunity is something you build over time. It's not something that just comes over a short period of time. So it's important that most people keep fit, make sure you're eating healthy, even before you contract the virus. So that's what determines whether you'll have a severe form of the disease or not. It's not the vitamin C and zinc, as most people have ended up taking, or any other tablets that may be out there. The other important thing is to keep hydrated. You can use a mouthwash. This reduces the viral load actually in the mouth. We give antihistamines for people with nasal congestions. You can get a cough syrup if you're coughing. The other important thing is both the psychosocial and the nutrition support. So making sure you're doing this, you're keeping fit even during that time, you're eating healthy. Those are the things that will help you to recover faster. It's not the medications that you take, because all this is dependent on your body's immunity. In case you get admitted, then there are additional medication that you get. A good example is dexamethasone, which is among the few drugs that have been shown to actually work. And this is for people who are getting oxygen. We also have other drugs, what are called immunomodulators, like tocilizumab, and others that are actually given in the hospital, including plasma therapy, where we get blood from someone who had previously been infected with COVID-19. Usually we recommend less than 3 months, because that's the group that we've seen to actually have adequate antibodies. And these are the people we now do blood transfusion with someone with no disease. I want to stop there for about the updates around COVID-19, and we look at now the vaccine itself. So vaccine, I must say, vaccines, this is not the first time we are having vaccines. We've actually had vaccines for a very long time. And some of you may be aware, if not all of us, there are several diseases that have actually been eradicated by use of vaccines. A good example is the smallpox. And now we know things like polio are almost also being kicked out in most countries. So vaccines have been there for a long time. It's not the first time we are actually seeing vaccines. So it's very important that we understand that and we see. And starting off by what is vaccination, I must say it's a simple, safe, and effective way of protecting yourself against harmful diseases before you come into contact with them. So for someone who's been vaccinated, actually you've used your natural defenses. What you're doing is like training your soldiers and showing them this is the enemy. In case the enemy attacks, you need to regroup very fast and attack the enemy. That's what vaccination does. It doesn't protect you from actually getting the actual disease. It helps your body to actually fight it when it comes to infect you. And vaccinations work, and they work either using the creation of what are called antibodies, which are the defense mechanisms as I've talked about. And what happens with vaccines is that we'll introduce a part or a killed or weakened form of the germs, in this case, the viruses or bacteria. And then once it's introduced, one thing that is very important is that we must understand that they cannot cause disease. You will not get the disease from getting vaccinated with COVID-19. So if anyone tells you that you got the disease from that, that's a lie. The vaccine actually contains a very mild form of the virus, which is either killed or reduced in its what is called the virulence. So it is not able to cause the disease, and this has been studied over time, as we'll see. And what vaccines do is that they create what is known as herd immunity. And herd immunity becomes very important. And that's why we're encouraging people to come in groups for those who qualify to receive the vaccines. And there are two ways of developing herd immunity. One, it's either the people you introduce a disease in a non-vaccinated community, or secondly, you introduce the disease into a vaccinated community. For the group that is not vaccinated, we usually see a lot of people dying from the virus because they do not have any protection. Their body are not able to regroup. The antibodies or other cells in the body are not able to regroup and fight the infection. So this takes time, and we are likely to see a lot of casualties. But when we have herd immunity through vaccination, is that the people who are vulnerable, in case they get the disease, then they're able to get protected from the severe form of the disease. And that's very important for us to know. And we've been able to achieve herd immunity for various viruses. As I've mentioned, things like polio, rotavirus, which is discussing more about that, another pneumococcus haemophilus. And these are vaccines that are actually given in childhood. So we've managed to achieve a lot of herd immunity, which is helping a lot. As I said, most of them, the way vaccines are made, you either weaken the particular, what is called pathogen, in this case, the SARS-CoV-2 or the COVID-19 virus, or it gets killed, or you take a part of it, or you take genetic material. And we'll discuss this of either the pathogen or what is known as a delivery vehicle. For COVID-19, what the mechanisms that have been used, either the whole killed virus or the particle or what are known as the nucleic acid vaccines. And good examples, as you'll see, these are the Moderna, the Pfizer. We have the vectored vaccines like AstraZeneca. So these are the different ways that we've managed to create and develop the vaccine.
Hello, Dr. We can't hear you. I think we can give him a few minutes. Maybe it could just be a technical issue that he must be sorting. But as we proceed with the webinar, we'll kindly request you to be jotting down any questions that you might have on the chat area. Then we can address all of them at the end of the session. Let's give Dr. about a minute or two to sort out the technical issue, then we can get back to the webinar. Apologies once more for the technical hitch that Daktari has had. I'm sure, as we might all be aware, with the new working norm that is there due to COVID, once in a while we experience technical issues here and there, but we've gotten hold of him and he's actually joining back. So in about a minute, we should continue with the session. Thank you for your patience. Apologies once more. I know it's taking longer than expected, but we expect him anytime back now. Maybe we can allow one or two of you to take a health break, maybe get a glass of water or something as we wait for Daktari to join back in. Thank you for your patience. Maybe as we wait for Daktari to join, for the ones who are still in or the ones who have not taken a health break, I can be addressing some of the questions that I can see that are directly related to Britam. So I'll address just a few of them before we wait for Daktari to join back, the ones that are not directly related to COVID that only Daktari can address. So just give me a minute. Yes, I have seen one of the questions asking if Britam covers COVID-19 and if not, what are we planning to do about it? So yes, Britam is covering COVID-19 in government accredited hospitals, just as Daktari mentioned some of them. And we are also covering, sorry about that. And we also have products that have COVID-19 if we have a member who prefers to be attended to in private facilities. So private facilities, I mean like the Aga Khans and the Nairobis, if the member prefers to be attended to in those facilities and not the government specific hospitals, then we have products that are tailor-made to ensure that the member can be able to access that. We have our Britam Milele cover, which is an individual plan that has a COVID rider in it. So if a member happens to have COVID positive diagnosis or hospitalization, then you're able to pay for the bills from that specific limit. Also, to add on that, we also have a COVID cashback benefit. It's basically a cover that ensures that if a member is actually admitted in hospital, then we can proceed and pay back a specific amount depending on the sum assured. Then this only applies to hospitalization. So noting that COVID was not, or the pandemic was something that was very new world over, of course, as Britam, we had to come up with ways, innovative ways to ensure that all our clients are covered one way or another. So just as I mentioned earlier, if as a member you prefer not to be seen at government hospitals in specific, you'd prefer to have a wider coverage, then we have products that are tailored for that. But if you don't have a COVID cover as of now, then that means you're only allowed to be seen in government accredited facilities, which all this information and a list of the government accredited facilities, you can actually get in the website. The Ministry of Health website has a list of where you can be seen should someone be diagnosed and need treatment for COVID-19. Let me just scroll through the questions and see if there's any other directed to Britam, then I can address them as we wait for Daktari to join in. Actually, most of the questions I'm seeing are directed to Daktari. So I'm still scrolling through and I should be able to advise any directed to Britam in a minute or two.
Apologies for that, I'm back. Kindly allow me to share my screen.
Okay, thank you, Daktari. So I'll hand it over back to Daktari to proceed as I summarize the questions that we have in the chat area, but I'll still encourage you to continue jotting down any questions you might have, and we'll still address them at the end of the webinar. So Daktari, back to you and welcome back.
Yeah, so sorry guys about that. So I was just talking about how vaccines are made. And I want to take us through the various ways we test actually the vaccines. So they go through what is known as the clinical trials. We start off with what is known as the preclinical. And by preclinical is where we test it in the lab using mice and other animals, mostly the apes. And this is done for a period of about 2 to 3 years. Then it goes through the clinical trial, which is divided into 4 phases. And phase 1, you want to check and see, is the vaccine safe in humans? Usually we lose at a small number. Then you go to phase 2, is it producing an immune response in human? Then phase 3, it wants to test and see, is the immune response actually going to protect human beings against the particular organism. Then phase 4 is usually what is known as the post-marketing surveillance. This actually happens after you've actually done, the vaccine has been approved. On average, each phase takes about 3 to 4 years, and we look how we were able to actually achieve, cut the time that is required actually to make sure that the vaccines have gone through the processes. That's the same image, more on a pictorial. And the question, as I said, is we've seen the different phases, phase 1, 2, 3, and 4, taking almost an average of each phase of 3 to 4 years. How come the COVID vaccines were made so fast? One thing, start from scratch. They were built on what are called existing platforms that have been used for other vaccines, such as Ebola. Then the other thing is that the use of new technology, what is known as messenger RNA, as we mentioned, when this comes into the body, actually it gets destroyed immediately. The other important thing is there's a lot of political goodwill at each stage, so that instead of the vaccine going through the whole process of having to wait for other vaccines to be approved, there was a lot of jumping of the queue, and this is because of the political goodwill that was there. We also had several participants that were available for the testing at each stage, and these in total made sure that we got the vaccine in a record of 1 year. This was achieved mostly through collaboration, and this has been very important, especially for the African continent. The COVAX, I'm sure some of you may have heard about it. It's the organization that actually has led to the acceleration of the vaccine development and access of the vaccines in an equitable manner. And it's led by various organizations. Gavi. Gavi is not a new organization. It's an organization that has been there for a long time. And actually, they're responsible for most of the vaccines that are under what is known as the KEPI. That's the program for immunization in Kenya. They actually give most of the vaccines, and that's why we get vaccines for free. Then also WHO and the organization called CEPI. So these COVAX actually came together, and they produced the vaccines that have now been availed to most countries. Actually, they're targeting about 20% of the countries will get their vaccines through the COVAX, and Kenya is one of them. Include what is known as the Moderna, Pfizer. We also now have the AstraZeneca, the Sputnik, and also the Johnson & Johnson. Moderna and Pfizer are mostly available in the US. And the reason why we don't have them here is because of the storage, and you'll see that. They require temperatures of actually -90 for them to be used locally. which is not currently what we have as the infrastructure. And that's why we'll see why we chose AstraZeneca, which requires between +2 and +8. The Sputnik vaccine is also now available in the country. This is the Russian vaccine. It's now being availed in mostly privately, and you have to pay for it an average cost of about $70 a vial, an injection. The other thing about we have is the Johnson and Johnson, which is a single shot vaccine, which is also been available at this time. The reason why Kenya chose AstraZeneca is mainly due to our capacity in storage. We have depots all over the country. I'll show you almost each several depots serving several counties, and this is how the vaccine has actually been distributed. And the storage capacity in these places is between +2 and +8, and this can be monitored real time. When we have gadgets that WHO gives that actually are able to monitor these temperatures, making sure that the vaccine a person is receiving has been stored appropriately from the time of manufacturing to when you get that injection. And this becomes very key. If we were to introduce some of the vaccines that require very low temperatures, we cannot guarantee that they'll be safe for use because we don't know if we've actually maintained that temperature that is required. And these are the various depots in the country serving different counties, which has actually enabled us to actually take the vaccine. Good thing we are not starting from scratch with the distribution plan in the country. So we already had a system that exists, and this is what has actually been adopted, and that's what the country is using. And these are the factors we considered, as I mentioned, the storage. We also looked at a vaccine that has actually been pre-qualified. The other way we did was use what is known as the viral vector. This in case is the adenovirus. And this is the example of the vaccine I was talking about, the AstraZeneca, that we used the Ebola platform that was already existing. And all we needed to introduce was now the SARS-CoV-2 virus. And also the cost was also something that was also considered. And the question we continue to ask is this vaccine safe? We've seen several people actually getting the vaccine, starting all the way with the Pope. We've had other global leaders and also locally, even our president has also received the vaccine. So these are safe vaccines that have been thoroughly evaluated for safety, and they have a very good safety profile, as we'll see briefly in what are the side effects. One thing I must say about vaccines is, and COVID vaccine particularly, when you get a vaccine today, it doesn't mean you'll be protected immediately. Actually, it takes about 3 weeks for you to have an immune response that can protect you. And after 3 weeks, this continues. We don't know for how long. And that's why actually you get a booster. The reason for the second dose is that we want to make sure that the initial dose you got is able to actually get boosted so that the protection can increase. And this is the distribution part for Kenya. For a vaccine to be effective, we need actually to immunize or to achieve what is known as the herd immunity, as I've mentioned. You need to vaccinate about 60% of the population. However, Kenya settled at 30%, and the target was mainly those who are at risk. And this is to be done in phases. Between January to June, the period we are at right now is phase 1. And we know phase 1 was targeting mostly people who are in the healthcare workers, looking at the people who are more at risk, the police, the clergy, the teachers, and also we also introduced people who are above 58 years. And the reason for this is we want to target people who are vulnerable to try and save them. Phase 2 is for people who are above the age of 18 with comorbidities. Then phase 3 was looking at people who are either in the hospitality, the tourism industry, and also people in congregates, especially people in the prisons. Those are the people, also people in the slums were considered in phase 3. The government promised that the phases may actually overlap. We don't have to wait till July next year for us to start phase 2 and 3. So they are going to overlap, and hopefully by around October. We are hoping that all the people will all those who are eligible will get the vaccine. And that's the same thing I was talking about. So when you look at eligibility, or the person who is eligible to get the vaccine currently, especially the free one from the government, is one, it's an elderly, those above 58 years. We talk about the healthcare workers, we talk about the frontline workers, the clergy, police, and teachers. The other thing that we look at is the person themselves. And before you come in, we'll ask you whether you have any symptoms. We check your temperature to see if you have a fever. And if you have a temperature that is above that, then we ask that you do not get the virus, the vaccine, sorry. The other important thing is that you must not have, for people who have COVID-19, and we'll be looking at this, if you've suffered COVID-19 in the recent past, but at the time of you coming for vaccine, you do not have any symptoms, or you've done a COVID test and it's negative, then you can go ahead and get the vaccine. However, if you are positive and with symptoms, you become ineligible. We are going to give you the vaccine. And that's what I was talking about, the fever or other symptoms or active COVID-19 infection. People who've had previous allergy to a product in the vaccine. The good thing with this vaccine is that it doesn't contain particles that are, or parts that are made from eggs or chicken. So previously, I know people had mentioned about people with allergies to eggs and chicken. That's not a contraindication. The other thing is that the vaccine, since the testing was done in those above 18 years, we usually do not recommend the giving of vaccine to people less than 18 years. Another important thing is that for those who are breastfeeding, you can still proceed and get the vaccine. Breastfeeding is not a contraindication. For people who are pregnant, the only time we'll give you the vaccine is if the benefit outweighs the risk. And by this, we mean that this is someone who is at a very high risk. Either they have underlying conditions like diabetes and hypertension that are poorly controlled, though asymptomatic, then you can still go ahead and give them the vaccine. However, the doctor has to weigh the risk. And this is something you have to agree with your obstetrician or the doctor who is following you up that it's safe for you to get the vaccine. However, it's something we don't recommend in those who are pregnant. The way it's given on the upper outer arm, sorry, and a dosage of just 0.5. It's a very small dose. Actually, most people will not feel the jab, the injection. It is very fast, and within a short time, it's finished. And usually, as I said, it's 2 doses for the AstraZeneca. So the recommendation is between 4 to 12 weeks. However, government chose 8 weeks, which is the midline. I know there's been so many questions around whether the second dose will be available or not. One thing, as I said, the first dose is the most important because that's what initiates the process of immunization and protection. As you get to the second dose, you're given what is known as the booster. If you miss the second dose, we usually say it's recommended at least within the shortest time period, less than a month, you should be able to get the second dose. If you get AstraZeneca as the first dose, then you need to get AstraZeneca as the second dose. Do not mix the vaccines. You can't get AstraZeneca as first dose, then get the Sputnik as the second dose. It has to be the same brand of vaccine, because they all work differently. So it's important that we know that. And in case you travel to a country where the second dose is not available, you can actually start a new schedule with the vaccine that is available. The main side effects include what are known as the flu-like symptoms, injection site pain, redness, swelling at where the injection was given. You may develop a mild fever, tiredness, headache, muscle pain, chills, and joint pains. And these will last usually only a few days. Within the second day, actually the following day after the injection, most of the symptoms will have gone away. What has been shown to persist, sometimes it's actually the injection site pain that can stay a few days. However, within a week, all the symptoms have actually resolved. And this becomes very important for all of us. In case the symptoms persist, then you need to go and get evaluated. We've had people contracting the virus either in the queues or when they were getting the vaccine or around that time. And some people have actually tested positive. And the reason they test positive is because they got exposed either when they were getting the vaccine or around the same time. It's not the vaccine that gave you the infection, and that we must remember. It's the same risk that were there before. And as I said, you need about 3 weeks for the vaccine to protect you. So you need to take care. Getting vaccinated doesn't mean now you throw away the mask, you throw away all the protective equipment that you've been using. You still need to use them. You need to keep social distance. And the reason being is you're still at risk of getting the virus, and you can easily also spread it to other people who may be vulnerable, especially if they've not been vaccinated. The rare side effects, and I know this has been questions that have been asked, include the anaphylaxis, and that's why immediately after you get the vaccine, we actually recommend that that you take around 30 minutes. If there are no symptoms, then you can go home. However, if in case you get this severe allergic reaction, there's medication for it. Clots has been a big discussion and a reason why most people don't want to take the vaccine. A paper that came out this week actually said in the study, about 0.004% of the population actually ended up getting clots. However, this is a very small portion of the people of the population that gets the vaccine. If you compare this with people actually who get COVID-19, COVID-19, the percentage remains at around 16.8, almost 17%. So if you get COVID today, your risk is actually higher for you developing a clot than if you got the vaccine. The important thing is we are now aware about this, and in case they develop, then we know how to manage. And that's why you require still to be followed up very closely from the site that you got vaccinated. In Kenya, this was the other day also, about 487 people had actually been vaccinated. And this number keeps growing every day. Majority of the healthcare workers who are the target group. Also, those above 58 years, they're also coming out in large numbers. And that's why we're encouraging people to still go ahead and get vaccinated. The vaccine is safe. We've not had any incident in the country. I know previously there was such a report, but when investigated, the Pharmacy and Poisons Board indicated it was not due to the vaccination. So the vaccine is safe. I would recommend that if one is eligible, then they need to go ahead and get the vaccine. At this time, I'll just talk briefly about Dr. Safiri and what we do as we go to the next session of questions. Yes, so I'd mentioned that. So Dr. Safiri is mainly a concierge medical company, and we offer quality and convenient health services at the comfort of your home. So the same services you'd receive in a hospital, we bring them to your facility. We have doctors, clinical officers, consultants, nutritionists, so the whole range of the same healthcare workers that are actually in the hospital. I lead the team, and thank God we got this head of state commendation last year for our fight against COVID-19. Our promise to our clients is we offer dignity. Our services are quality. We use healthcare providers that actually have been accredited and thoroughly trained. Several of our physicians and our consultants are actually trained abroad, some most locally, but they are up to task with the management of patients. We bring convenience to you, so you don't have to leave your house. And I know right now most people want to actually be managed from home. So that's one thing that we aim at. And also we offer holistic care. We want to be an end-to-end. You don't have to worry about medications or tests. We bring all this to your house, such that when you contact us, then we're able to offer all the services that you'd require. These are the same services we provide. We do this in form of packages. The COVID-19 package, which most people know us about. We also have the home care package for both if you're just unwell or for long-term care and end-of-life care. So we're able to offer these at the comfort of your home. We also do wellness checks for both nutrition and health and fitness. We also have a dementia and diabetic, or what now we are calling the the chronic care package for people who have chronic diseases. We also have a telemedicine package, which actually works with the other packages as well. So in case of anything, do not hesitate to contact us. We'll be able to assist you. So I want to welcome questions at this time. Maybe over to you, Jessica.
Thank you very much, Daktari. So I think now we will go straight to the questions. Allow me to read, I'll read the questions out, then Daktari, you can address. We have a question from one of our attendees asking that she has already gotten the jab and she wants to get pregnant. Does she have to wait until she gets the second dose, or it's okay to conceive at this point?
As I said, pregnancy is not an absolute contraindication to getting the vaccine. So I would say she can still proceed and conceive. I know some people actually, someone had asked also previously, whether it's okay to, if you've gotten the vaccine and you didn't know, then you become pregnant, should you get a second dose? Yeah, I would still recommend you get a second dose because it acts as a booster and helps you to achieve more protection. Remember, pregnancy is also a high risk by itself. Pregnant women, some of them have actually ended up with severe disease, and some have actually died from COVID-19. So I would still suggest that you still get a second dose. However, get monitored very closely by your obstetrician or the doctor who is doing the follow-up.
Thank you, Daktari. One of the other questions we have is, what is the worst can happen if one does not take the second vaccine? So you've already received your first dose and you're due for your second dose, but for one reason or another, you've not been able to get the second dose. What is the worst that can happen?
As I said, the reason why we give 2 doses is because the first dose acts as the initiator of the immune response. So you want to develop an immune response and see how you can fight these infections. When you get a second dose, it acts as a booster. It just augments what you have been given initially. So in case you miss the second dose, it just means your immunity is still there, it's been achieved, but it may not last that long as the person who gets the booster dose. Remember, this is a new vaccine. As I said, you don't know for how long the protection will last. So we don't know. We can't tell you need another dose after 10 years or after 1 year. And that's why the booster dose actually helps to prolong the period that you require the other dose if need be. Yes.
And Daktari, just to add on that, so if you don't get the second dose at all, and what happens if you delay getting the second dose? So for instance, if a member's second dose is due, for argument's sake, today on 15th of April, but they're not available, so they can only take it in a month's time. Is there any effect with taking it much later than the due date?
As I said, the period that has been from the studies that were shown, it's the second dose should be given actually from 4 weeks to 12 weeks. However, for logistic issues, basically for logistics and at the point where the government thought at this time is the best time for us to get the vaccine as the second dose, the government chose 8 weeks. So for people who are getting even up to a month, I think it's fine. You can still go ahead and get the vaccine. However, beyond that, the second dose may not be effective, may not help you much. So we're saying up to a month. There's an allowance. It's not just that immediately at 8 weeks you must get there and then. So there's a small allowance, but we encourage people when they're due for their second dose, they should go ahead and get it at that time.
Okay, thank you, Daktari, for that. We have a question, explain the efficacy of the Zelenko protocol. Quite a number of people have tried it and it seems to work, but the expert opinion on the same is lacking in the country.
So Zelenko is, for people who may not know, this is, it's a regime that has actually been used. Most of the doctors who used it were in Germany. A must say, when you're looking at science and how medications are used in human beings, they go through various what you call levels of evidence. For you to use a particular drug or a particular medication, it has, or a particular regime, there are various studies that are usually done. For the drugs that have been approved, the ones I mentioned, like the dexamethasone, things like tocilizumab, those are medications that have actually gone through what are called RCT in brief, without going into the details. For this Zelenko, it was just one individual or a small group of people who did what are called case studies. And these are, when you're discussing the levels of evidence, if it's down there, it's not a high level of evidence. So we can't adopt it as a country or different, or WHO or other organizations do not adopt it, basically because of the level of evidence. It's a very weak evidence, so it's not something that has been actually studied well to show that it is effective. The other thing is that the drugs that are used include drugs like hydroxychloroquine and azithromycin and the use of zinc. Hydroxychloroquine was shown not to be of any use in most of the studies that have been done. And that's why for most of the, in fact, the side effects that are associated with hydroxychloroquine should be something that people need to be very careful. It's one of the diseases that actually can affect your heart. So you need to be very careful even when you're taking these regimes or these, because they may affect you adversely. So it's that. So for us, we are not recommending the Zelenko regime, mainly because of the level of evidence. It's a very weak level of evidence.
Okay, thank you, Dr. for that. The next question, there's been an uproar, especially on social media, where we have facilities that apparently can set up an ICU facility in your house, an ICU or HDU facility in your house. Of course, noting that most hospitals are full to capacity when it comes to ICU and HDU facilities for COVID positive clients. So would you advocate for this, and what are the pros and cons of taking this up?
So one, it's very difficult to set up an ICU, even for a hospital itself. It's not an easy, you'll find actually some hospitals opt not to have ICUs. And the main reason is one, the personnel, actually the human resource.
Dr. You've gone off again.
Can you hear me?
Yes, now I can hear you. Can proceed.
Sorry. I was saying about ICU setup is one, it's a multidisciplinary thing. You need several consultants, for example. You need a physician, you need a respiratory specialist. Sometimes you may even need surgeons, you need anesthesiologists. So it's not a one person or a one man show. And that's very important. Then when it comes to the nurses that you're getting, you need critical care nurses. For one ICU bed, you need at least about 5 nurses to manage. So when someone says they are setting up an ICU in the house, then also you need also other services, not only in case you need things like dialysis, for example. If a patient requires, because most of the ICU patients will also require other services like dialysis, they require regular lab tests being done, regular imaging, that's x-rays. So it's very difficult to set up an ICU even in a hospital setting. So if someone is claiming to be doing that, and this is a discussion that actually is going on in our forum, I think they are misadvising the public, and it's not the right thing. You can't, it's almost impossible to set up an ICU. And that's why it's it's wrong marketing, basically. Maybe they will be able to set up home care, and this is being done. You can bring an oxygen, that's not an ICU. Bringing of oxygen, bringing of nurses in the home, that's not setting up an ICU. That's just home-based care. And as I mentioned, you have to be very selective when you're choosing the patients actually who qualify for home-based care. If it's a person who is very sick, we are likely to lose the person if they're not in a hospital setting. So you have to select the patients very carefully before you manage them at home. Yes.
Thank you, Dr. Can a person who is vaccinated for the COVID-19 transfuse or donate blood to an individual who has not yet been vaccinated, and also maybe one who has also been vaccinated?
So you can hear me?
Yes, we can hear you now.
So a person who's been vaccinated can actually donate blood. The most important thing is for the blood to be screened for other diseases, especially HIV, AIDS, malaria, all those, to make sure that, and also to make sure that the blood is compatible. So they can still go ahead and donate blood. It's the same way we've been vaccinated for other diseases before, and we are still able to donate blood.
Now, we are saying that we are on the third wave of COVID-19. Can you segment the first two, that is the first and the second wave? And what are the statistics on the third wave compared to the first and second wave?
So, as I said, there are several things that were looked at when we talked about the first, second, third, and the question is whether we are still also going to have a fourth and fifth wave. We usually look, one, at the cases that have actually been reported, basically the daily cases that have been reported, and also looking at what is known as, I mentioned the positivity rate, how many people are testing positive and what is the positivity rate. So if you look at the cases, initially they were very high during around the first peak was actually around July. That's when we saw so many people suffering COVID-19. The cases had actually gone very high. I don't have the actual figures right now, but then the second phase happened around November. And now this third phase has actually started taking place around all the way from end of February. That's when we started seeing an increase in the number of cases. One thing that I must mention is in phase one, there were very few people who needed critical care services and even oxygen. As we've moved on, second phase, we required more people requiring oxygen and ICU facility. When you look at the third phase, most hospitals, most patients getting admitted right now, almost all are requiring oxygen. So that's the difference. We are seeing more sick people now with the disease who are requiring more specialized services, and that has been our fear. If you look at most hospitals, they're reporting there's been the oxygen levels actually going down to a risky. So for some people, actually have had to cancel surgeries, the elective surgeries, mainly because of oxygen levels. So, and that shows you the demand has actually gone very high during this third phase.
Okay, do we know, or are there statistics of any known Kenyan who has had COVID-19 more than once? Positive COVID diagnosis.
We actually have several patients who tested positive during phase one, and now in phase three they've also tested positive. So the cases are there. So that one thing we must remember, and this is something which we report as a hospital, when you do the antibody titers, we've seen very few people having antibodies after 3 months. So which means in case you got the virus before, it doesn't mean you're protected from getting a second infection. And that's why we encourage people even who've suffered COVID-19 to still go ahead and get vaccinated, because vaccination uses a different method for developing immunity. So it's very important that you still go ahead get vaccinated if you had suffered COVID-19. Yes.
Okay, thank you, Dr. If there's a delay in the dispensation of the second dose, are there any side effects or problems that will come about if one is not vaccinated at the appointed time or date, or maybe even opt to take a different vaccine that is available at that point?
As I said, there are no major side effects. The only thing is we are not sure how long the first dose will last you. And that's why the booster dose helps to actually increase your protection. That's all that it does. So missing the second dose doesn't mean you're going to be affected negatively. It just means the level of protection may not be as the same as the person who got the booster dose. that's the most important thing. So it doesn't affect you negatively. It's just that the level may be lower of protection.
Okay, we have a number of people who are fearing vaccination on account of fear of altering the genetic material. To what extent does the AstraZeneca affect the genetic material of a person?
So the vaccines do not affect the genetic material. As I mentioned, immediately the RNA particles get into your body, they get destroyed. So they're not able to enter what is known the cell nucleus, so they can't integrate with the human DNA. So that's very important for us to know. It doesn't have any effect on the human DNA.
Okay. Thank you, Dr. for that. And how about the issue of the injection, that is the vaccine, and alcohol? There are no clear indications about that.
So the reason why you may not want to take alcohol is mainly the side effects of the vaccine. Remember, most people will have headaches, fatigue. So by taking alcohol, this is likely to worsen the side effects that you're going to experience. However, it doesn't affect the vaccine in any way. There's no alcohol is not a contraindication to getting the vaccine. So you can still go ahead and take alcohol, but remember the side effects. You may not be able to distinguish whether you're having a hangover or side effects of the vaccine.
Okay, now we have quite a number of people who've asked that they're currently recovering or have just recovered from COVID-19 treatment, in hospital treatment, that is. They were on oxygen and some even had other comorbidities like hypertension and diabetes, and that they've now tested negative. So can they take the vaccine now? And if not, when? So basically the question is, what are the dangers of receiving the vaccination immediately after you've just been treated for COVID-19, or how long should you wait after recovery?
So the recommendation is immediately you are declared COVID-19 free. So if you had COVID-19 and the government stipulates if for those people who did not have any symptoms, if 10 days have actually elapsed from the time you tested positive, then you can be declared free of the virus. For someone who had symptoms, those who had been admitted, one is that either they've done a test and it's negative, or they've been more than 10 days plus 3. That's what I was talking about 14 days, but at least 3 days without symptoms. By the time you're getting the vaccine, you must not have active disease. You must not have any symptoms, like you're not coughing, you're not having chest pains, no fevers. Then once those resolve, then you can go ahead and get the vaccine immediately. Remember, I said the vaccine protects you against the severe form of the disease. So if you have underlying conditions, the diabetes, hypertension, then you need to get the vaccine almost immediately. You've been cleared or you've been declared COVID-free. So get the vaccine as soon as possible if you've tested negative and without symptoms.
Okay, why aren't children receiving the vaccination and yet their immunity is not as strong and healthy compared to adults?
So as I said, the vaccine was tested in those above 18 years. The other thing, most children will not get severe form of the disease. In fact, we've had very few, we can count less than 5 or even fewer patients who actually had severe form of COVID-19 for those who are less than 18 years. So it's not a target group for the vaccine, and that's why it's not being given to children. However, currently there are studies that are ongoing to see how we can introduce the vaccines as part of the normal immunizations program. And this is to mainly ensure that the protection lasts longer. So that's what the studies are currently being conducted to see how the vaccines can be introduced to children. But currently, we are not targeting children as they are not at risk of severe disease.
Okay, thank you, Dr. for that. At what oxygen level on the oximeter should one visit the doctor or hospital?
So immediately you start seeing it going down but the level which is critical is 90. If you're having oxygen levels less than 90, you need to visit the doctor, because that means you require oxygen supplementation. And it's important that you keep checking every day. You can check as many times, at least minimum of 4 times, spaced maybe every 4 hours. And the reason you're doing that is to make sure that the oxygen levels do not go less than 90. If they go to less than 90, it means you need.
Tarim, we've lost you again.
I'm still there.
Okay, thank you. Okay, we have a question on Pfizer. Is the Pfizer vaccine being used in Kenya? If so, how is the cold chain being implemented? And why would this choice be made when other vaccines don't require such an extreme temperature?
You can hear me?
Yes.
So the Pfizer is not yet available in the country. As I said, we only have 2 that have been which are available. That's the AstraZeneca and the the one from Russia. Those 2 are the ones, the Sputnik vaccine. Those 2 are the only ones which are available. And as I said, it's mainly due to the storage of these vaccines. That's why they're not available. Hopefully, or maybe after some time, they'll be available when we have the storage capacity. As I say, the most important thing is to make sure by the time you're getting a vaccine, it has been stored properly. Because otherwise, remember these they're vaccines, we call them live vaccines. So in case they're not stored properly, the active component then is actually gets what is known as denatured, and it's not effective in protecting you. So it has to be stored in the right way, so that by the time you're getting it, it protects you from the virus.
Okay, we have a member who says that they've already gotten the first dose, but they got a severe allergic reaction. Do they need to get the second dose, or should they consider a different type of vaccine like the Sputnik or Pfizer or any other that will have been launched by then?
So if you get an allergic reaction to the first one, then we don't recommend the second dose. You shouldn't get the second one. And then the most important thing, I hope she reported that reaction to the authorities, because these are, remember, I said right now we're in phase 4, so we are still monitoring the vaccine, and we need to keep reporting these adverse effects to the vaccine. So we would advise that she gets a different type of vaccine and not the same one that she got initially.
Okay, we have quite a number of questions. Actually, people asking that they're not in the front line, so they're not amongst the people in the first phase to be given, but they would want to get the vaccine. Which hospitals are they allowed to visit on walk-in? And they also don't mind paying. Is that recommended, and can they actually get the vaccine?
We still, for AstraZeneca, it's strictly following the rules that have been set out. You have to be in that category. It's not something you can pay for because it's free. The vaccine is free right now. So for those who do not qualify, they are not able to buy the AstraZeneca or pay for it. So it's not something that you can be asked for money about to receive the vaccine. However, for the other vaccine, that's the Sputnik, remember this is based on the ability to pay. I know several private facilities have now started stocking it, and you're able to get it if you walk in. So if you go to most private hospitals, you can ask them if they have the Sputnik, and they should be able to give you if they have it.
Okay, thank you, Dr. for that. I'll kindly request the attendees if we can, of course, steal into your time a bit, noting the technical hitch that we had earlier. If you can just take another 15 to 20 minutes to address the few questions that are remaining, and then we can come to a close. So we project to end at about 1:30. That will be the latest. So let me proceed to the next questions. We have a member who's asking, should they be tested first before getting the vaccine? And is there an effect or a side effect that they would likely get if they are vaccinated and yet they were positive and maybe were not aware?
It's not a requirement for testing. We don't do a test. We don't do a COVID test before vaccinating. Neither do we do a pregnancy test. So you're not required to be tested before you get vaccinated. The only thing is you will not receive the vaccine if you have symptoms. So if you are in that category of those who are symptomatic, it's unlikely the vaccine will have another effect on you. There's no cases where people who had a symptomatic disease and got the vaccine got a worse form of the disease. So it's very important that we know you don't require the test. And as long as you do not have symptoms, you go ahead and get the vaccine.
Okay, so we have a question where a member is asking that we should explain some of these vaccines that have actually been banned in some of the parts of the world. An example is Denmark that has just banned AstraZeneca, but it's being allowed to be given in Kenya. Why are we being encouraged to take them?
So the ban actually happened a few weeks ago, but the European Union came out and actually issued a statement, and now the vaccine is actually being given in most of these countries. Mainly the reason is that they looked at the safety profile. They also looked at the patients actually who suffered the clots, and it was shown they had other underlying conditions. So it was not purely because of vaccination that they got clots. And as I said, the risk is 0.004, which is very low. As compared, if you get COVID-19, I keep saying it was given the option of getting a clot from COVID-19 or getting it from the vaccine, I'll still choose the vaccine. And the reason being is, one, the risk is very low as compared to getting COVID-19. Remember, COVID-19 will get the clots and other effects to your lungs, especially the fibrosis. So it's very important for us to remember that as much as the vaccine is there and has that small risk of getting the clots, it's not comparable to the risk that is there with getting the disease itself.
Okay, there's a question asking, how best can you convince those who believe in the wait and see approach arising from the fear of the vaccine?
I'll tell them, I don't know if they're able to come to the hospital and see the patients. Then, like I can tell you, like for us, we're in the front line, mainly because we've seen the patients with COVID-19 and how they're suffering. I don't know if that's enough convincing, especially for someone who is at risk. For those who are not at risk, then there's no hurry. But for someone who is above 58 years, someone who has underlying conditions, I would say you need to take your life more carefully. We've seen how people are losing their lives. And remember, the vaccine is protecting you. So I don't know what other conviction they need, but they need to be aware that they're at risk of getting a severe form of the disease. So they should come out and get the vaccine if they're eligible.
I agree. To what extent has the antibody test been administered on the population to establish exposure to the virus? And how long after one has been exposed to the virus are the antibodies still detectable?
So there've been limited studies. I think Camry has done a number of studies. I know also one of the private labs, that's Lancet, they did mostly around the healthcare workers, and we were looking at the populations and how many people have been affected. I think at some point they reported almost close to 20% or more had actually suffered COVID-19. And remember, these antibody tests, they're able to detect the virus. Some of them will tell you up to a month, others up to 2 or 3 months. So by the time you have seen antibodies, that means you've either had the infection in the last actually about 3 months. So it's not actually an active infection. It could be something that you suffered a while back.
Okay. There's a lot of concern around the association of the vaccine to blood clots, and also concerns about under 30, so the people under 30 years. These are the questions encountered when you listen to the marketplace and estate conversations. What information is out there at the grassroots level to minimize the effects of the propaganda?
So I think this is one of the ways through such platforms where you call in the professionals to talk about it. So, and it's one thing that we're encouraging, even in those community scholars, and we'll come and talk to them and share the appropriate information. We've also, as an organization, Safiri, we've done a write-up of the frequently asked questions just to try and disseminate this to people and tell them what is the correct information. And also if they go to the various sites like the WHO, the Ministry of Health, so they're able to get the right information. I think the biggest challenge we have in our country, I think most people trust the hearsay and the word on the street more than just going. I'm sure now almost everyone has a phone where they're able to Google, and they can easily get the correct information online if they're not sure. However, most people don't want to read. They want to hear information from some other people. So I'd encourage that people invite the healthcare professionals, even in their churches and other places of worship, to just come and talk to the general population about the vaccines and other conditions as well.
Okay, are there pre-existing medical conditions that are completely contraindicated to taking the vaccine?
There's no underlying condition that is a contraindication. None that I'm aware, other than the people who got the allergic reaction to the vaccine. There are no other contraindications. So, in fact, people with underlying conditions are the target group, and they should come out and get the vaccine.
If you're below 58 but hypertensive, can you be prioritized? And where can one get the vaccine? As most places you go, you find it's finished, or queues are too long, or you need to have connection to get in. Some people are even charging a fee to facilitate vaccination.
So, as I said, for the AstraZeneca, which is the government, it's been given out in phases, and the people who are actually getting the vaccine are those above 58 years. So if you're less than 58 years or above above 18 with a chronic condition, remember you'll be considered in phase 2. And the phase 2, as I mentioned, is set to begin in July of this year. So I would say you still wait for your time, but also keep protecting yourself from getting the virus.
Okay, there are also quite a number of questions relating to eggs and the vaccine. So if you have an egg allergy, should you still get the vaccine? And also there's quite a lot of information contraindicated apparently if you have egg allergy and taking the vaccine. What would be your take on that?
So eggs and the chicken, the vaccines are not made from any of these. They don't contain any of these proteins. So I know there was that information earlier on. However, the manufacturers and the people involved in the preparation of these vaccines came out and said the vaccines do not contain any of these components. So you can still go ahead and get the vaccine even though you have allergies to these eggs and chicken. So it's not a contraindication. You can get the vaccine still.
Okay, I saw a certain hospital advertising in the dailies that there's a patient who needs blood donation, and the person donating must have recovered from COVID-19 in 3 to 6 weeks. Could you kindly speak to that?
So this is the group I was talking about as one of the treatment modalities that is being given in the hospital. Actually, I think we are currently the only ones given in the country. That's it's called the plasma therapy. And basically what we do is we take blood from someone who suffered COVID-19 in the past, and we do what is known as a blood transfusion. However, the blood has to still be screened, because remember, you're giving, the same way you get a blood donation is the same thing that we do. We still screen for other diseases and make sure that also it's compatible with the person receiving the blood. So we're just getting the blood and using the antibodies. And this is why I mentioned that what we've seen with people who've stayed more than 3 months, then the antibody levels are very low, and actually they're not protective. So that's why we're encouraging people actually earlier average of about a month to come and donate blood. That's where most people will actually have more antibodies.
Okay, thank you very much, Dr. for that. I think we have actually been able to tackle all questions that had been raised. Quite a number of people are asking about a recording of the webinar and the slides. So yes, you can be able to view the recording even much later at our YouTube handle, which will be posted on the chat area. Then you can save that specific YouTube handle. Also, it's been sent to you when you are joining or registering for the webinar. So I'd like to sincerely thank each and every one of you for your patience, especially when we had the hitch, and of course, extending by a few minutes for us to be able to cover everything that we need on the COVID-19. So Dr. also, thank you very much for taking us through this. I think we've been able to gain quite a bit, and I think we are leaving the webinar more informed and less stressed or worried about the vaccine. Thank you very much for everyone who has attended, and we will keep inviting you for more as we keep finding out more on what happens to us in COVID. Thank you very much, and now you can leave at your own pleasure.
Thank you.